Okay, so there is a bit of dural tension in the sacrum. And so just a quick, some assessment guidelines. If we're out at the lateral or the top of the ilia here, as gauged from the side, or that's about L4. So if I come down one more, the spinous process of L4, that's going to be the spinous process of L5, and then I'm going to be on the base of the sacrum. So that's one landmark. If I use the PSIS, the posterior posterior superior iliac spine, I had to think about what that meant again. I just come medial or inside of that line, you have the sacral sulcus here. And you see a little asymmetry there because the sacrum is actually torsioned a bit like this. And so it creates a deeper sulcus here. I can follow the sacrum down. So here's the spinous processes, or the sacral, the tubercles. And then you're going to have the corresponding sacral foramina just inferior and lateral to those sacral tubercles here. These are the foramina. We can come all the way to the bottom here, and this is called the ILA, or the inferior lateral angle of the sacrum, right there. So these are useful because, and then just coming just medial to that, and we will have basically where the sacrum meets the coccyx. For treating the dura, S2, so we had L5, the base of the sacrum, S1, S2, which is actually usually where there's like the apex of that curve, not always, but generally. That's going to have a dural attachment on the inside of the sacrum. So inside the sacrum, inside the sacral canal, the dura is attaching to the wall of the sacrum here. So it's used, I like to come along, and it's porous, or kind of it's a spongy bone. So it really receives the force. And we can come right along the sacral tubercles and kind of stretch inferiorly. We can go both ways, but in this case I'm going inferiorly. And that might seem rather superficial, and initially it is, meaning kind of the fascia and the ligaments on top of the sacrum. But as we sit with it a moment, we can actually sink beyond that and get into the sacrum. Now, what got us here actually in this treatment is I pointed out the tension here. I'll come back to that in a moment. Let me finish getting some of this done, getting some of this treatment done.